Hi, this is Paige Tony, and we're going to be discussing the anatomy and physiology of the knee joint. So first we have the femur, which is right here, the fibia, and the tibia. These make up the three main bones of the knee joint. Next we have the lateral condyle and the medial condyle. These allow for rocking, gliding, and rotating motions in the knee. Next, we have the fibular collateral ligament right here and the tibial collateral ligament right here. The fibular collateral ligament stabilizes the lateral side of the knee, whereas the tibial stabilizes the medial side of the knee. Next, we have the anterior and the posterior cruciate ligaments. The ACL is responsible for preventing hyperextension and displacement of the joint during flexion. The posterior cruciate ligament is responsible for the opposite, preventing hyperflexion and displacement during extension. We then move on to the lateral and medial menisci. These are both responsible for preventing displacement of the knee joint. Then we have the transverse ligaments, which stabilize the menisci during movement. Lastly, we have the patellar ligament and the patellar surface. This is where the patella sits, and this is what stabilizes the patella and helps it not displace. Posterior of the knee, we have some familiar structures. The femur, the medial and lateral condyles, the posterior and anterior cruciate ligaments, the medial meniscus and the lateral meniscus, the tibial collateral ligament, the fibular collateral ligament, the fibula, and the tibia. There are some new structures on here as well, such as the posterior meniscofemoral ligament, which develops tension during knee extension and helps in stabilization. The posterior fibular ligament of the fibular head attaches the fibular head to the tibular head. And the interosseous membrane shifts compressive load between the tibia and the fibula and separates the muscles from the front to the back. On the superior view of the knee, you can see the anterior meniscofemoral ligament, the medial meniscus, the transverse ligament, the lateral meniscus, the posterior cruciate ligament, and the posterior meniscofemoral ligament.